So, very good evening to my people. So, we have gathered here to discuss a very important and very underestimated power of thought. So, the topic for today's session is identifying first and then breaking the negative thought patterns. So, in CBT, as we are going to learn that one of the core skills is tending to our thoughts, whether we are able to see our thoughts as a spectator, whether we are able to see them totally without getting involved into it. So, this is a very important thing. We need to, sometimes we tell ourselves some lies, we tell ourselves some half truths, and then probably we get emotional about it, and then our behavior gets affected. So we need to develop this core skill using the CBT techniques. So we will be talking about how to go about it. So before going to the actual part of it, I would like to tell you a little story about Meeta. You can take any example, you can fix yourself into it. So Meeta is a girl, she's a married woman, and she has been working very hard in her company, in her place or in her job, and the responsibilities have increased. And she has also discovered of late that she has been betrayed by her husband and her marriage is shattered. Right. Now, what happens as a result? Now, slowly, she's getting sleepless at nights. She's talking to herself. She's not getting many answers. And for many months now, she's actually very much depressed. Then the other day, she goes to her office where she just blows up a critical review. And she's almost into tears in front of her boss when her boss says that, your performance is slipping down. She doesn't know what to do. She goes out, she doesn't know whom to talk to, and then she finds Mala, her friend, and she talks to her on the phone. And then she tells her that, Mala, this is what has happened and I don't know what to do. And she's crying on the phone. And this has happened to many people. Many of us have gone through many situations where we have not been able to control ourselves, and when we are trying to tell our story outside, and we just break up. So this is the story of Meeta when she's telling to Mala. Mala tells her that, see, Meeta, you have to see one thing, that in the first place, why did you get excessive responsibility? You got a promotion and so many responsibilities you have to shoulder because you were doing well, not that you were doing badly. They are expecting too much from you or more from you because they know that you are capable of doing it. So when she hears this thing, she just puts it in her mind, and then she moves forward. So today I invite all of you to become Meeta's friend Mala for your own self. Okay, so this is the story in which you have to fix yourself, the emotions and the thought processes that go in our heads. And sometimes we are not able to see ourselves when we are in a big soup or a mess, and someone comes out from the third side of a different perspective and tells us something. So CBT is all about being that friend to your own self. And how do we become our own friend is this session about. Okay, this is how we're going to find the blind spots in our thoughts. So let's start with what are negative automatic thoughts. These are extremely distressing thoughts which come one after the other, after the other. And it seems as if our mind has a mind of its own. They are so powerful. And there are, small triggers, and a whole spiral of negative thoughts will come. And then we will feel, unbalanced and uncontrolled. And we actually start behaving very weirdly because at that time, we actually don't know what to do. So now, how to put these things, how to know that these are the negative thoughts that I am getting. Okay, just before that, I would like to tell you the word harnessing. It's a perfect word. Harnessing is a perfect word for the negative thoughts, because thought is a power. It's an energy. It is, you can imagine, like water. Okay, when the water is going in the river, it is flowing with a huge current, and it is not harnessed. it can cause flooding, it can, just destroy mankind. But when you build a dam and you harness that power of the water, when you harness, then you can make use of that power. So what I would like to share with you people today is how to harness the power of our thoughts, how we can change our thoughts, how can we, break these patterns to our use, to our fulfillment. So let's go back to Mita's story. When she goes out, okay, and she just, stops crying and she pulls her car, just ready to go home, okay. And then the moment she takes a back turn, she does a small collision with another driver. Okay, it's not a big one, but then she manages to talk to the driver and she pulls the car and then she starts driving and talking to herself. And she says to herself, this again, I have messed up. I can't do anything right. Now the insurance is going to be high, the rates are going to be high, and I have to pay for this insurance. So this is what she starts thinking. And then she starts saying to herself, okay, can you hear me?
Yes, please continue.
Yes, just a minute. Okay, so is it, can you see me and hear? Yeah. So while she's driving home, and again a thought, erupts in her mind that I have messed this up also, and I can't do anything right. I'm slipping away. I'm not good for anything, right? So this is what she's thinking. And then all of a sudden something strikes her. And she says, if I had Mala in front of me, what I would have told her and what she would have told me back. So she just made it up in her mind and she said Mala would have told that, you've had a very rough day today, it's raining, and you budged into a car, but you talked very nicely with the driver and nothing major went bad. So it's good you kept your cool. And what else can be asked for? So it's okay, you can go back. Everyone does mistake. So this is what she thought that Mala would have told. So, and she smiled a little bit to herself. Meeta smiled to herself and she said, yes, probably, I am better and I can do things better and probably I should move ahead. So this is a small story where she, imagined Mala giving her some advice or a piece of, you know, different perspective or cognition. As all of us know, and Dr. Rati last time had very nicely explained in the diagram, that cognitions are thoughts. The cognitions are not only thoughts, they are also impressions on the mind. Suddenly you will see an image, or you will see some expression, or you will have some vague sense. All those things are also known as cognitions. So if we have a skewed thinking, if we are thinking something in a skewed way, then it will lead to behavioral changes, it will lead to severe anxiety, and we will behave in certain ways which the other person may not think that we are normal. Okay, but those are normal for us because we are thinking and our mind is saying that no, this is correct, and that is why that anxiety is developing. We will come to those errors of thinking and how we can next time see them as errors and then change our thinking. So how to identify a problematic thought? For example, I'm a doctor, I'm getting ready for my, chamber, I'm going, and I'm all ready and I come in the chamber and everything is great, and suddenly I start feeling something negative, or suddenly on the phone I say something which I feel that I shouldn't have said. I had a very good mood. How come I just talked to the person in a rude way? So if you are having a problematic thought, then that means there's a sudden shift towards a negative emotion. One. Second, there are certain times or certain days where you are not able to shake the negative feeling. You have been feeling negative and low for a very long period of time. And whatever may happen at home or at office or something great, you just seem not to, overcome that negativity. Okay. And the third is the identification is if you are struggling to act in line with your goals. Whatever you wished for, whatever you want to work for, you are struggling very hard, you are struggling hard to focus to get those things done. Let it be something repair at home, let it be children, let it be office work, or a simple laptop which you need to get repaired. Those small things also we try to put off when we are struggling to act in normal things, when we are struggling to get small things also done, because the negativity, it burdens us, and it burdens us so much that even small issues and small things, we think it's too much and we can't do it today, or we can't do it in the coming days. Now let's have a little discussion about the main aspect and the main core thing of today's session. It is enlightening, it is something which you would love, and it is something that we can talk about later, and you can even do a homework on the thought or the thinking errors and the cognitive distortions that we all have. They keep on changing, but we all have. So distortion is something like, for example, you see a spoon and then you see a face in the spoon, and you see that your face is all distorted, but your face actually is not distorted. It is something that you're seeing that it is distorted. It seems so real that my face is like this, but in actually it is not like that. So our thoughts, they just come and enter the brain and they get distorted, and we think that that's correct. We always think that whatever we are thinking is in line with the reality, which is not true. If you are feeling something, it may not be true. There can be error in your thinking. So I would like to discuss certain cognitive distortions by giving you an example or a little statement which our mind will be telling. Like, for example, black and white thinking. Can you come up with an example, any one of you? What is black and white thinking? So black and white thinking is something like seeing the things in extreme terms. If I do poorly in this exam, I'm a total idiot. This is something which we say to ourselves. We are taking two extremes. Agar ye ho, to hi aisa hai, nahi to kuch bhi nahi hai. For example, some young girls can, they think that the figure should be, 36, 24, 36. Only then I have a good figure and I am a beautiful girl. Otherwise not. So this is something we have actually thought that we are living to extremes, either black or white, nothing in between. This is a distortion of the mind. Second, Dr. Rati also last time, just started off with this distortion of shoulding. And it's a very, very important distortion in our head. Most of us, so many, I would say even me, we should things. What is shoulding meaning? Shoulding means that thinking the way we want things to be, the way they ought to be. If we think that it should be like this, then that is the correct way of doing it. For example, we should have at least one boy child. The parents come up, or the couple comes up, and they say, we should have at least one boy child, and then they have their own description of it. Why should the boy child be there? This is the reason and that is the reason. But it's a very distorted thought. Why should you have? Because you are thinking a boy child should be there, so that means it is correct, it ought to be like that. Aren't there families where boys are not there and they are not families? So shoulding is a thing which gives us some sense of distortion, and it leads to a lot of suffering. The children should touch the feet of elders. We have it. They should, because it's correct, because you think it's correct, because maybe that is the only way that they can show respect. Aren't there other ways to show respect? So that's what. So this is a shoulding, it's a distortion. And I hope many of you can also come up with other examples like this. As a mother of a small baby, I will say, I should have been more patient. I mean, you are human, you can lose patience and you start feeling guilty, मुझे तो ऐसे कर लेना ही चाहिए था. So it's a distortion. You did your best. So you come up in the guilt cycle. We will discuss about it. We will try to go to it and try to break the whole thing. Then is overgeneralization. Overgeneralization means like believing that one instance applies to every situation. For example, I don't know the answer to the first question in this exam, and I think that I'm not going to answer any question in this exam. I will not know any question in the exam. I missed my train last time. I know I'm going to miss it this time also. You are all overgeneralizing the whole situation. You're thinking that once it happened like this, every time it's going to happen like this. This is something we tell to ourselves many times. I say to myself, I failed in this exam, मैं तो pass कर ही नहीं सकती. I cannot. So that's a negative distortion. That is a thinking error. That is not how things work in life. Then another very important cognitive distortion we have is catastrophizing. Okay, thinking of a situation is worse than it is. For example, I am working in a shopping mall. Okay, and the customer has come and I'm trying to show them the clothes or whatever, and probably they get annoyed too much with me or whatever, and then I start thinking, as I'm going to get fired. The boss is going to fire me because the customer got annoyed. So you are just giving the worst scenario to what little bit jig happened between you and the customer. So suddenly you'll get into some other mood. You will just feel that, okay, I'm going to get fired, and your whole behavior, the whole process of thinking, of action is going to change. How your mood will be till the end of the day when the boss is going to talk to you. So we catastrophize. We just make the worst thing possible, right? Then is discounting on the positives. So I would take an example of a married couple, and the husband brings, flowers to her wife on anniversary, and he says happy birthday, happy anniversary and all, everything is okay. But she's not happy. She's discounting because she says, "Arey, घूमने तो लेके ही नहीं चले मुझे. We have not gone anywhere." And she is discounting what positive happened. He took out time, he brought flowers for her, and they had a good time at home. But because they did not go outside, so nothing happened. So the positive side of the relationship was discounted. So this is something, it's not the correct way to think, because we are skewing our thoughts, and it is a poor reflection of the reality. And then she may come up to something like, he doesn't love me. Hum jab the, when we used to date, we used to go out a lot, and just look at now we don't go out. Suddenly the good thing, it just vanished, poof. And only something which she thought discounted on the positives, it stayed, and the relationship suffered. Then another important cognitive error that we people have is emotional reasoning. If I feel hurt, for example, if I feel hurt, मुझे तो बहुत बुरा लगा. If I feel hurt, there must be something. मैं ऐसे ही रो रही हूँ क्या? मुझे क्या कुछ गलत है ही नहीं, मैं ऐसे ही रो रही हूँ. This is how things happen. You emotionally reason. You go through an emotion. You go through some process, and you think that something is actually wrong. For example, I'll give you another example. That emotional reasoning is, for example, you start feeling anxiety. Okay, you are too much anxious. You have to take a board flight from Bagdogra to Delhi. Okay, I live near Bagdogra. So from Bagdogra to Delhi, I have to take a flight, and I'm super anxious. My palms are sweaty. Okay, and I'm so nervous, and I feel my plane is going to crash, because I am getting that emotion of anxiety, and I'm thinking that now it is going to crash. This all is happening to me. Something bad is going to happen. Right? This is another thinking error. Then fortune telling and mind reading are a spectrum of jumping to conclusions. Okay, so I can give you an example of these. It is like something making predictions based on very scanty information, fortune telling. For example, you jump to conclusions. Like for example, it's written the rental company, if you want to, the rental company probably won't have any cars left. Already you are going somewhere and already you have thought in your mind that if I go and rent something, I will go there, I'm bad luck, there is something bad in me, I will go and I will not get the car. Something would have happened, all the cars would have been sold or rented away, or the good one I will not get. Many times it happens, I always get the bad taxi. Many times it happens. Okay. And then mind reading is like, for example, right now I'm sharing my screen with you guys and suddenly I stop sharing because of the lack of connection, and I start thinking, oh my god, what these guys will be thinking about me, I don't know even how to share the slide, what an idiot I am, they must be thinking she's an idiot. See, I am reading some mind, I am just talking to myself, and I don't know whether you guys, whatever you might be thinking, but this is what I'm telling that they might be thinking. I'm trying to read your mind. I'm jumping to a conclusion that this is what the people are going to think about me. Now, the mother of all, the mother of all cognitive distortion is personalization. When a certain thing happens, a situation occurs, it arises, we personalize it. We think that there's something to do with us. The whole day, the mother or the father of the child, they are busy in their work, and they are not talking to the child. The child may think that, oh, I'm not studying well, they no longer love me. Or the father is busy with some case. Okay, he has no time to even look at home. But the child is personalizing the situation in such a way that nahi, mere ko to pyar hi nahi karte hain, they are not, I have done something wrong, that's why now they are not, taking care of me, or they don't want to talk to me. And this happens a lot, many times. A situation arises, for example, you go to a party, a lot of people are there, and the host doesn't give you much time. Okay, and you think that there's something wrong with the person. मेरे को पार्टी में भी बुलाया, मेरे से कोई बात भी नहीं हुई, did not sit with the person, and there's something wrong. There is something, she did not talk to me, she did not talk to me properly. I think maybe I have done something wrong. You personalize the decision. हो सकता है उसके मतलब कि it is possible that she has thrown a party and the food hasn't arrived and she's all in her her wits are out, and we are personalizing the whole situation. This is an example which you can refer to, this thing which happens a lot with us. Okay, now something like entitlement. Entitlement, I would like to describe, is a certain cognitive distortion which we feel that we have the title to, like I am the mother-in-law and my daughter-in-law has to do it. She has to do it for me. She's my daughter-in-law, wo nahi karegi to kaun karega? She feels entitled because of her position. The daughter-in-law does a lot of things, कि ऐसे करना है, मम्मी को वहां लेके जाना है, ये करना है, all sort of things she keeps on doing. But the mother-in-law doesn't feel that she's doing out of care or love or what. She has to do it. Mother-in-law is entitled and she's positioned to get through it. For example, another example, the child says that I have worked very hard. I have worked so hard. I should get a laptop. My parents are bound to give me the laptop. I'm entitled for it because I've worked very hard. So these are the things we tell ourselves. And then, we cut happiness, we cut connectivity, we cut love, we cut affection, we cut, communication, because we start talking to ourselves. Or actually, mein aisa nahi hua hota hai. In reality, things are not the way they, in reality, the things are not how we interpret them, because we have these filters, we have these thought filters which make us see things which are actually not there. And it is not for some of us. We are tend to think like this. We are wired to think in this kind of negativity. And this is the root cause of so many of us who have suffered a lot in life. Another cognitive distortion is outsourcing happiness. How can I be happy if they don't respect me? If the children don't respect me, how can I be happy? They have to respect me, only then I will be happy. So you're outsourcing your happiness. You are wanting that someone outsourced people, the other people have to do something for you, only then you will, feel a sense of gratification, a sense of happiness. Then another is false sense of helplessness. Helplessness means you are believing that you have less power than you actually do. For example, there's no जरूरत ही नहीं है अप्लाई करने का जॉब में, there is no need to apply for the job, मुझे वैसे भी इन्होंने लेना नहीं है. So you are already making yourself helpless and powerless. अपने आप को बोल दिया मेरे को करने की जरूरत नहीं है. Why to go there when I know that they will not take me? And just the opposite, extreme responsibility, false sense of extreme responsibility, believing that you have more power than you think that you have. So for this, I would like to give an example that I would have been, this is what I have written, if I were a better mom. हो सकता है कि मैं ज़्यादा अच्छी अगर mom होती, if I were a better mom, my children would not be doing so much of screen. And this is the guilt cycle which goes on so many parents nowadays. And I went through it too, I'm not a very good mom. I would have been a better mom if I would have been able to guide them properly. Or aisa hai nahi, I will keep on guiding them. I will do more than is required, but this will come in my mind that I would have been better if they would not have been able to do much of screen, or they would have realized that so much of screen is bad for health. So I would like to give some tips for all of us to keep in mind, including myself, that when these negative distortions come, first we need to recognize them, that okay, this is a negative thought, this is how it is affecting me. The cues and the clues that I told you, that sudden change into a depressed mood, or not shifting of the negative thought, these were the clues that we had seen initially in the previous slides, how to identify. And the third is struggling to act in line with our goals. Even the small pettiest of things and the goals of the day, we are not able to fulfill. So these are the things that are happening to us. Then what are the tips? What are the tips that we should keep in mind to deal with this kind of a thought process, this powerful, distressing thought process of our brain? So the first thing that we need to keep in mind is that the thoughts, first we have to see what the thought is. It can be about the past, like, oh, I did not go there because this happened. That is why I will never talk to her. Something is happening in the past. Okay. Or the future, I'm actually ruining this interview. He's talking and I'm ruining this interview. Or of future, I will never be able to pass that exam. I will never be able to do. So these are the thoughts that come. This is the way they enter our brain. Okay, at that time, what we need to do is we have to give ourselves the space. We have to give the space to sit quietly in a place, close our eyes, and try to visualize exactly what is happening in the mind. Take small and slow breaths and try to see exactly what is happening without getting affected by what is happening. I had a very massive bad fight with someone, with a friend, or with my brother, or with my husband. Just imagine that exactly what happened. Just imagine, visualize it. Be aware whatever thoughts are coming into our mind, by seeing that impression, by seeing that image, be aware of whatever impression and images are coming. That is how you start, by recognizing. And then you sit with a paper and a pen and you try to record your thoughts. For example, with Meeta, what happened? There was a critical review, okay? And then she became very, very sad. That was the emotion. So she recorded. Or for example, something happened to us. Some our thoughts, and then recording our thoughts, took a paper, sat in a quiet place, and exactly jot down exactly what happened and what we felt. Then, now this is the main area where the change can occur. As Dr. Rati, I remember, she told that there are break points in between the thought, the behavior, the thought and the behavior. There is a break point where we can change. That it is there the CBT works. So the same thing I've written in the new slide, that the event was the critical review of Meeta. The thought she had is, I am messing up, and then the emotion was that she was very sad. The thought can also lead to a depressing behavior. Like how it would affect the behavior. The behavior is, are you able to listen to me, please, everyone? The event, for example, the event was invitation to meet a friend, right? But the thought came that I'll have nothing to say, I have nothing to do there, there will be so many people, I don't think so, I should go there. And then the behavior is like you turn down the invitation. So it is the effect of the thought is seen in our behavior. Don't go there because something happened and our brain said something to us. So the situation is something happens, then the thought comes, and the situation is interpreted by our brain, and then we feel something as a result of that thought, and then we behave in response to that emotion. So this is how things happen. A situation comes, we filter it through, we see it through whatever conditioning or whatever thought process we have, and we interpret it accordingly. We have some emotions, and then either we fight, either we fly, either we behave amicably, or we get scared, and then the behavior comes. So now I would like to invite you all to see this very important slide. And here we will learn how to get to the bottom of our thoughts. This is a well, it is a spiral. The thought process is a spiral. Apparently, on the surface, we may not feel that the thought is actually causing some kind of a problem, or it is distressing, but it will be reflected in our behavior. So, for example, the event is getting dressed in the morning. I go in front of the mirror and I'm getting dressed. Okay, I'm wearing my shirt, I'm putting on my trousers, and a thought comes to me, oh my God, my shirt looks small. Okay, and I get depressed. The emotions that come up is that I get depressed. And what is my behavior? My behavior is that I change the outfit. I change my outfit. So what's wrong with it? The thought is okay. It doesn't look distorted at all. Do you think anything is wrong in this thought that my shirt looks small? But the emotion is of being depressed. The emotion is of, being not able to do something, or the emotion is of feeling low. How would a thought like this? How would a thought like, okay, my shirt looks small and I also change my outfit? Okay. How would a thought like that lead to an emotion of depression and sadness? So this is how we have to go to the bottom of the thought. This is a surface thought, but because it is causing depression in us, a low feeling in us, then that means the thought has to, go, it has to be seen in detail, that exactly what it is. So I would try to share a downward arrow technique with all of you. That, for example, there is a thought, for example, the same thought that came into the mind, my shirt looks too small. What does it mean? It means that I've been eating too much. What does that mean? It means I have no discipline. And what does that mean? That means I will never reach my goals. And when you actually tell yourself inherently that, yeah, I'm not going to, reach my goals because I don't have any discipline, of course, anyone will be depressed. So this is the technique that we should follow when a certain behavior we are able, when certain behavior, depressed or low behavior or anxious behavior we are going through, and the thoughts come which we are surface on the surface, not very heavy. So we need to go to the, go to the bottom of the thoughts. And this is exactly what we were telling ourselves, that we lack discipline and will not be able to reach the goals. That is the reason that we got depressed. So common themes for our thoughts. This is something I would like to discuss, because in the coming CBT chapters, in the coming CBT sessions, this is something very, very important. So what are the common themes for our thoughts? Everyone can go through these themes of hopelessness, of threat, and of injustice. So the themes of hopelessness includes thoughts like, I'll never feel well again. It is about a person who's already anxious, who's depressed, or who is not able to make up whatever that person thought in life. So the thoughts will come of hopelessness. मैं नहीं कर सकता. I will never be able to feel well. मैं हमेशा ही ऐसा रहूंगा. I will always be like this. And then the feeling will come of worthlessness. I am not worthy of it. I am worthless. I am depressed. The feeling of being depressed, not being able to even carry out the normal routine. And then the behavior will be of withdrawal, not being able to talk to anybody, not being able to share your thoughts, don't feel like doing anything at all. That is the theme. Then another theme of thoughts can be threat. I'm going to fail this examination. Thought come, मुझे लगता है मैं कर ही नहीं सकती. It is okay, leave it. Okay, feeling of anxiety, feeling of danger and uncertainty. What will my future be? And behavior of self-protection. जाना ही नहीं है, करना ही नहीं है. Miss the examination. Don't do it. Okay. Or fake, sometimes people have hypochondriasis, they have stomach ache, or they one day before they are just, out. They faint. They can't do anything because actually they're not able to deal with the negative thoughts. Okay. It happens. So many girls I have seen, they fainted before the examination, or something happened to them and they just left the examination. Many things like this happen. Third theme that is very, very, commonly seen is injustice. She treated me, unfairly. That is the thought. mere se theek se nahi kiya. I was not treated fairly. What is the feeling of anger? Main feeling is of anger, of mistreatment, okay, of some rule violation, anxiety, and the behavior will be retaliation. It will be retaliation. Okay, so please remember these themes of hopelessness, themes of threat, and themes of injustice. What do I actually mean by themes? Theme is that many situations in your life will occur which will lead to hopelessness. Many situations in your life will occur where your cognitive distortions or your thinking errors will lead you to a threat-based theme. Okay, many things will occur which will lead to a theme of injustice. Many things will happen where you will feel some injustice is happening. When you go to work, you'll feel injustice is happening. When you come home, you will feel injustice is happening. When you are with your children, you feel it's unjust for the children also not to care about you. So when too many aspects of life come up with the same theme, then that has to be noted, because that is the root of your core belief. And we will be taking core belief sessions in later. Now let's come to another important second part of our session, is what is the strategy and how to break the negative thought patterns. What is the strategy? Because we have to be cleverer than our thoughts, we have to be more clever than them, and we have to frame a strategy to break this negative thought pattern. Okay. So it is not something that you paint a very rosy picture in front of you and you think, no, everything is all right. मैं तो गलत ही सोच रही होंगी. This is a thinking error. Okay. So it's not like that. It is something that you are going to look for evidence. The first step in the strategy is to look for evidence that supports your thought. आपको एक thinking thought आया. It may not be an error. Okay. It may not be, it may be the truth. Maybe it is actually aligned with actual reality, right? So the step one is you make a column in your page, in your journal, to look for the evidence that supports your thought. Step 2, then you look for the evidence that doesn't support your thought. There may be certain things which may not support whatever you are thinking. You write down what are those thoughts. Okay. Then the step 3, then look for the possible errors in your thinking. As I have told you, so many errors, and there are many more. There are many more actually. So you have to look for the possible errors that there might be in your thinking. You might be not thinking in the correct way. Then you can go to the step 4. Then you can identify a more accurate and helpful way of seeing the whole situation. You can turn around the situation, and you can see it in a more useful manner, in a perspective which is more accurate, more aligned with the reality, and more helpful for your own growth. And then step 5 is that you need to notice these changes, and you need to record the new thought process that you have on your thoughts, on your feelings, and on your behavior. Whatever you have just shunned down the negativity and you have come up with something else or a new third perspective, then you need to record that, okay, after thinking in this perspective, what is my new thought process? What is my new feeling? And what is my new behavior? And that will give you the answer to live in a more wholesome manner. So I'm giving you a small example of the same steps that have happened. Okay, how we need to literally see the evidence of what we are thinking. Okay, so the event is, for example, I forgot to call my mother on her birthday. Now, it's a very bad thought. What is going to come into me? My thought is, I'm so inconsiderate. Or, my God, what happened? I forgot my mom's birthday. Right? So that thought, I'm feeling guilty. I am feeling inconsiderate. Jalo, ye bhi nahi tumko yaad raha. You are not of that level also that you can even call your loved ones on their birthday. जाकर उनके साथ बैठने और तो दूर की बात है. Right? This is the thought that's coming. Now, what is the emotion that arises? The emotion arises of being very sad and guilty. Ki maine kya kiya? What did I do? And many of us have it. Maybe it's mom, maybe it's your children, maybe it's your husband, maybe it's your students. These kind of emotions come up. And then what is the behavior? Not able to take her call, to apologize, or not even able to take her call. Ki, Arey, main bolungi kya? What will I say? This is what I've done. What will I say? So this is the event, the thought, emotion, and behavior. And now what will happen? It is going to distress me for a long period of time. So how do I do CBT analysis for this kind of an event? See, this is a little bit. This is a little chart, okay, where I'm going to see for the evidence, where I'm going to see for the evidence which is going to potentiate my thoughts. So some of the evidence is like, I don't remember the birthdays of my friends also. Okay, I forgot to send my parents an anniversary card, sometime back. I forgot my mom's special birthday. I did not call her, right? Now, this is something which I have written in the evidence for the motion of whatever thought I am having. Okay. So the second part of my book is writing against the thought, against what has happened, right? So what I have written that, something like, oh, I sent her a card. It was not her birthday, but I sent her a gift. Understand? So are you guys, able to listen to whatever I'm saying? Okay. Sorry. Right. Thank you. Sorry. I thought I'm just speaking to myself. Okay, fine. So against the thought processes, oh, last 2 months, I sent her a nice suit or I sent her a nice gift, right? So what, I forgot her this thing. So anything, and again, I've written that I was busy taking my sick daughter to the doctor on my mom's birthday. This is something, against what I told myself. Okay. I am very considerate now of possibly having hurt my mom's feelings. I thought to call her on her birthday, but not when I was able to. Right? So what I have written that I did try to call her at that time. Now I want to call her, and I've been always thinking about her. And at that day, on that day, these were the important things that had happened. So these are the things which are reflecting more towards the reality. I'm giving a positive feedback to myself that it is not that you are an inconsiderate daughter, but you have to consider that these things also happened, right? You just can't, what do you say, label yourself as something without seeing the other side of the story in your own head, not only for the other person. So the next part will be where there are were there any errors in my thinking? Yeah, I overgeneralized it. Yeah, I assume that a single mistake defines me as a person. I did not call on her birthday, that means I am inconsiderate, right? I overgeneralize the whole situation. So what is a more accurate and a helpful way of looking at the situation? I was busy with work. I was busy with my daughter's illness, and I did intend to call my mother. In future, I can set a reminder to make it, make it harder to forget. But the bottom line is that it's not the end of the world. And my mom was very understanding about it. And when I finally made the call, we had a good chat. Everything is okay. She would have said, "Nahi, beta, koi baat nahi. It's okay. I know you were very busy. It's not a big deal." And everything. And what I was doing before that, my head was not making me call her because I was thinking what I have done, whether I'll be able to call or whether I'll be able to apologize. What is she going to tell to me? And it can be anybody. Actually, mom and daughter relation is very, very, good. This kind of CBT is not needed in that because it's not, you don't have to write anything. You can just, tell your mom everything. That's not the issue. But just it's an example to show you people that if something happens or an event happens, then you have to take yourself two parts in it. You cannot discount the positives of what you have gone through. Right. So in this page, what happens? The effects of the new thought. This is also important that you need to record that what the new thought is teaching you. So it is saying that I no longer felt guilty or sad, and I felt good to remember that I really do nice things for people around. Maybe not on birthdays, but otherwise. So I'm not an inconsiderate person. So that is, that was a deceptive thought that was trying to make me more depressed and sad. So this is a little part of something which I wanted to share with everyone. And my concluding note is that as counselors, as you go out in the world and initially try to counsel your friends, or maybe you counsel some relatives, or you try to do counseling on your own, for your own. You do CBT counseling for your own self for so many issues that probably everyone has, then always remember that this is workable for people who are functional, who are intelligent, and who can actually take the whip in the hand and tell themselves that yes, this is correct and this is wrong. This is a poor reflection of the reality and this is not. So it works well with people who are educated, who are intelligent and functional, and who know that yes, they can work on themselves. So CBT works for people who can actually dedicatedly work with themselves, right? So it's a small homework, and the summary is that you can use this page or you can write and you can tackle any distortion that you might be going through in your life right now, and how you can create evidence for motion and against the thought, and what are the negative patterns involved and how you can break them and come up out to be more free and live your life in a more better splendid manner. So thank you very much everyone for paying attention. It's not moving.
Today, Dr. Chhavi covered all the things required for CBT. Wonderful.
Thank you, Dr. Mittal. Thank you for encouragement.
Really appreciate that you prepared your presentation and made a PPT despite your very hectic schedule.
Yes, I had a very nasty cesarean in the morning previous to LSES. but she's doing well. Yeah.
In big hospital. I really appreciate that you put a lot of efforts and time to prepare your.
Thank you, thank you. It is one of my favorite, favorite topics because it helps so many people. And why should people, they should know. So many educated people are around, and they, what, they go to their parents or maybe they go to friends where they get biased opinions. It is always better to go to your own self and try to find out what is the best for you. Try to figure out what you can do, what you can't do, and how things can work. This is what I always wanted to share with everyone.
But that's great.
Thank you. Thank you. Thank you.
Going ahead, we will have CBT sessions more, which will be restricted to students who have taken CBT in their combination. For the previous batch, in the fellowship, there was a CBT combination. In the present batch, CBT is add-on. And only for those who have taken CBT as their combination, we will share the worksheets with them, uh, depending on the topics. So these worksheets can be useful for a client with anxiety, stress, reassurance, and all those things. Right? So we'll learn more. See that. Now, anything else you want to say, Dr. Chhavi?
Yeah, no, thank you very much. I had a very nice time. I hope it will be beneficial to all of us, and would like to meet everyone again in the next CBT session. Yes. Thank you. Thank you.
Good. All of us love to hear from you. That's great.
Thank you.
Next session we'll see on Monday, and we'll send the link for Monday on time. And Wednesday marriage counseling session, the same link you will use. Friday session again we'll send on time. Okay. And whenever there is a CBT session lined up, it will be informed to you. And from next time onwards, CBT session it will be reserved for only those who have CBT in their combination. That's so. Okay. Thank you, everyone. Thank you. Have a great time. Be in regular touch. And those who want to talk to me, call me Monday, Tuesday, 11 to 1.